During my undergraduate studies, I studied speech pathology and audiology, but during undergrad I shadowed a physician assistant who was able to come up with a diagnosis and a treatment plan for me, and I became interested in the field, so I did some shadowing, and I really liked how, as a physician assistant, I could extend the care to patients, particularly in rheumatology. There's a shortage of rheumatologists, and so as a physician assistant, I'm able to bring care quicker and closer to patients under the guidance of a supervising physician. I worked in internal medicine for a little over 3 years, and in my internal medicine career as a PA, the most interesting cases that I had were rheumatologic in nature. I really enjoy the diagnostic approach, so sometimes solving rheumatologic cases is like working on a puzzle. There's a lot of pieces to the puzzle, and oftentimes those pieces have been going on for years and years. And medicine is not a black and white area. Medicine is definitely gray, and rheumatology is very gray, so there's a lot of problem solving. And I like the ability to follow up with patients on a regular basis in rheumatology as well. The most rewarding aspect, I believe, about rheumatology is that oftentimes the patients have come in with symptoms that have been going on for years and years, and they've seen other doctors, they've tried other treatments, and then when they come to us and we're able to establish a diagnosis and a treatment plan, they're able to finally experience some relief with treatment, and they come back and they're feeling better. The physicians and physician assistants at ARA work closely together. My role is to help extend care to patients. So for new patients, I can typically get patients in a little bit quicker. And so that's been really helpful in terms of disease management, as earlier care often leads to better prognosis in the future. So I became interested in medical cannabis because a lot of our patients are struggling with chronic pain, and unfortunately there aren't a lot of good options out there, and as we all know, there is an opioid crisis going on right now. So any alternative to the pain medication approach that we have right now is welcome, and so I've really enjoyed working with medical cannabis, as it's another approach for patients to try. When I'm not working, you'll find me with my husband and my rescue dog. We're often walking around Old Town trying to find new restaurants, as well as enjoying the museums on the mall. I feel that by listening to patients and really taking the time to hear what they have to say, I'm able to come up with a better understanding of how they're doing, how their disease is progressing, and how we can manage their treatment and come up with an approach that works for them.